We're gonna have our PPE on. It doesn't say this, but it does say maintain asepsis. So you should have it on because you're using desensitizer. What else would I have on that I don't have on right now?
Your mask and your eyeglasses.
Okay.
Sunglasses.
Yep. The patient will have glasses too, always.
And their bib.
Yep, and a bib, always. If you lay them back for anything, just have a bib on them. Okay. So now I have my appropriate supplies. You're gonna have a basic air water tip with a light ejector, cotton rolls, and a 2x2 in case you need it. Okay. So that's your setup. Now, review the manufacturer's instructions. Who did I hit? Oh yeah, you. So let's read that.
The highlighted.
Yep.
So, treatment of dentine prepared to receive a complete cast restoration. Protect mucous membranes by using a rubber dam. Remove moisture from the prepared dentin by applying a gentle stream of compressed air. Apply Gluma desensitizer with a pellet and leave for 30 to 60 seconds. Make sure that only the smallest possible amount required is applied and that it only comes into contact with the area to be treated. Dry the dentinal surface carefully by applying a stream of compressed air. Rinse out thoroughly with water and apply suction. Cover cavities and or areas near the pulp with suitable cavity lining before applying the desensitizer.
Okay. So now I'm going, let's say they have recession right here and here on 30 and 29. Okay, so I'm going to place the cotton rolls. And you can use a cotton roll holder if you're more comfortable with it. Ideally, we should use, what does she say?
Rubber dam.
Okay, because there's glutathione in this and HEMA. Okay, that's very irritating to the tissues. So now that since I'm doing recession areas, I'm going to try not to hit those areas. Now, before I place this, it does have to be dry. So you can air dry it, but I'm going to tell you it's probably going to be tender, and I would let the patient know. Might be a little sensitive, some cold air. Okay, you could dry it with this too, if they're way sensitive, based off your patient. So either way, it needs to be dry. Okay, then I'm gonna place some of the Gluma. Okay, and I like my brush band. There's some water in it. Okay, this is not the actual sensitizer. Then on the margin, you're just gonna place it right above the gum line so it doesn't go on their gums, because it will kind of drip down. Okay. Now, what do you think I'm going to do now? Let's say I placed it.
You're gonna dry it.
Remove moisture.
Let it sit. Yep. And then I'm going to dry it and check it. Okay. Typically, when I place this, I'll let it sit, and then I'm going to tell them, hey, I'm going to blow some air. You let me know if you feel it. And then it's got to be a gentle stream, so you might want to practice out here in your glove. You barely hear it, right? Mm-hmm. So that's how I'm gonna go. Barely. They're like, oh, I feel that a little bit. Okay. Okay, so then I'm gonna place a little bit more. Okay.
Did you happen to notice before she used her air water, she pushed the button?
Check on her glove first.
Yep. You know
Yeah,
why?
Because in case gross stuff comes off.
Water. Yep. Because it's an air.
I don't want water
syringe.
on this.
We can't have moisture, and so that's why you're always testing it out here before. It's a habit, but I just wanted you guys to know that you don't directly just go from here and play. You've got to do it out here first, just to make sure there isn't any water in your tip.
I'm gonna do it again. So just air, gently. A little bit air again. I feel that a little bit still. And then let's say you did it 3 times. Okay, we're gonna do it again. Not getting it. And notice I'm keeping my hand in there to keep this dry the entire time. I'm not taking it out. I'm not changing anything. Okay, we're gonna wait 30 seconds. So try it again. And then a little bit air again. And I might do a little bit harder this time to test it. Oh, that feels good. I don't feel any air. Then you're done. Okay, I had this done on me actually. Doesn't taste good. And it fluffed my tissues. I got it on my tissues.
You want to rinse the patient afterwards?
Can you rinse them after? Did it say on there?
Yeah. Just because you said it doesn't taste good, and you don't want them leaving with that gross taste.
So I can rinse them out afterwards.
Thoroughly with water and apply suction.
Yep. I'm gonna rinse them out, and it's a full rinse because it's probably on, especially where I was. And then again, corners of the mouth, not the throat. Corners. Okay. So that is a full rinse. Remember the difference.
What are the corners of the vestibules?
Yeah. Okay. That's it for that part. So we just applied it after we read the manufacturer's instructions. We maintain asepsis so far, kind of. The PPE on, so I get docked for that.
You would be able to pass it.
No, I wouldn't have passed. Discuss why desensitizing agent would be used and how desensitizing agents functions. The functions of them. So what does yours say? So we just did a class by recession area, by the gum line, which is typically what it's used for. That's how it was done on me. That's how I've done it on my patients. I've also done the other two ways. Do you remember in class what I said yesterday?
I don't.
And when we learned about desensitizers. So it shows on here we can use it for what? No. It's showing you can use it for crown prep because it's prepped crown and a filling.
Okay.
So you can use it under restoration to help with desensitivity and for a crown prep. If the tooth had a root canal, it's not going to be alive. There's no need for desensitizer, so you don't need it. Okay. But typically, crown prep, when I'm done, right before I put on my temporary, after the final impression, I will put the desensitizer on, then cement my temp. Filling, you're going to put it on before you place your etch and bond and all that. Okay? What is the desensitizer sealing? We learned that yesterday. And the other time. And there's picture after picture after picture of it in this PowerPoint yesterday. And before that when we were learning this.
What's the question again?
What are we
It's the
sealing?
little like thingy-mabobbers in the tooth. I know what it's called. Genial tuber.
No, that's
No, that's right here.
that's radiology.
The trauma.
It's a
When we did our
yes.
molds yesterday.
dent and tubule.
Okay.
I was like, I can picture
Genial
the
tubercle
slides.
is right here on an X-ray. You can see the outline of it around the foramen. Not the foramen.
Tubercles or
Dent and tubercle. Sealing the dent and tubercle. Because remember I said they open up?
Yeah, and then don't they open up every so often?
Well, it depends on the patient.
Like, so some patients might come in more for desensitizing agents less than
Yeah.
others.
I'll tell you, that worked really good. It worked on me for good years. I haven't really needed it.
So that's why.
Some people are 6 months, some people it'll take years. Mine's been fine for years.
So what you just
It
did,
works
what,
so good. It just seals the dent and tubules because that's where my cold sensitivity comes from. So when I eat cold things, it just, it zings. And this seals it and makes it better.
Can you like overdo it on that?
On this, not necessarily on the tooth, but if you get on the tissue, yeah. Because there's glutaraldehyde and hema in
so you have
it.
to be really precise. Like,
Yes, and you need to know all that. You need to tell me what chemicals are in this, what all their uses are in this, what is it sealing. Okay, so you need to know what you're doing and why, and then other uses that you're going to use it in the office. And it's used highly today for all these reasons.
so
It's
would
great
a patient,
stuff.
would a patient be coming in because they have sensitivity or?
Sometimes, yeah. Normally, like hygiene appointment, I'll be like, they're usually when they come for a checkup, they're like, it's sensitive there, and then they seal it right there. And hygienist can do it. Assistant can pop in and do it. You guys can do it.
It says discuss why desensitizing agent would be used. We did, and then and how desensitizing. Oh my gosh! And how desensitizing agents it functions.
Yeah, it's sealing the dent and tubule.
Oh, okay.
Yeah. So it's not cold to your ice cream, and I like ice cream. I don't want to not eat it because my teeth are sensitive.
Do you chew ice cream though?
Sometimes when you bite into a popsicle,
I don't.
but I usually lick it because my teeth are sensitive.
Oh, man, I feel
But if it's really cold and it gets over here, it hurts. If I don't have that on it. This stuff works really well. Okay?
So not too bad then.
No,
It's really
this is
nice.
pretty quick comp. It's just a matter of knowing the other information is where people get stuck sometimes. Okay? So